Why is my camera never on when I start? I don't know why it does
Wait, did
that.
your name? Oh no, it didn't change. I thought your name changed, and I
Oh,
was like, yes, it
I
worked. I
have
was just
no
talking.
idea why I'm gonna rename myself now, but
That was a
honestly,
chunk of chapstick
oh,
on my.
nice. We're doing really well today. You're thriving.
Oh my god.
I gotta change my name over here. You've got chapstick chunks everywhere.
We're totally leaving it in.
Wow.
Oh my god. I can't handle life today. Like that is a summation of my life experiences in the past. I don't even know how long it's chapstick melting season apparently already for cars here.
Listen,
So we're there.
I am trying to pull up my Insta real quick just so I have stuff from yesterday.
Yeah, I had people send me like really long stuff too, which I totally am here for.
I also did.
But I'm like, yeah, and let's be clear. First of all, I'm not editing this. This is just all going on the podcast.
Oh yeah.
And I have not read through any of it extensively. So we going in blind.
Oh yeah, today's gonna be great. It's gonna be just kind of shooting shit and talking about the medical industry. And the goal is, let's be honest, the goal is we want to make sure this is still informative and hopefully empowering. Like that's kind of the goal. The goal is like empowering you to feel good about talking to your doctors in any field and recognizing that advocating for yourself shouldn't be abnormal.
Correct.
You have a purpose here. There's just also going to be some
rants.
Yeah, I'm sure.
I mean, we started this with chapstick chunks, so that's where we are today.
Yeah.
That should be the title of the episode is chapstick chunks.
That just sounds lovely. You're gonna be like, what is happening here?
I'm dying.
Well, this all started, we can just say this all started due to not really the first time this has come up by any means, but this all started from a message that I received on Instagram from somebody who is in the process of kind of getting some things together before working with me, which I think is awesome. She wants to like be in a good place physically with her health in other areas before she invests in working with me. But she updates me, which is great. And she had a really shit experience with her doctor, who was basically telling her that what she was doing, if that's actually what she was doing, so he was accusing her of lying, but if that was what she was actually doing, that sorry, my dog is about to panic because yeah, you hear that. I leave YouTube on, but if animals come on the screen, he starts panicking. So yeah, I turned it off because he's now like, wait a minute, where did it go? He thinks that our TV, I think, is, yeah, hopefully he calms down. He thinks that the TV, I think, is like a window sometimes. And so if he sees other animals, he's like, where are they? I have to find them. So we're just going to hear a little bit of him in the background for the next couple of minutes. But essentially he told her, to get back on track, he told her that if that's actually what she was doing, that she should have been losing weight at a much quicker rate, and that there's no way that that's what she was doing, and it didn't make any sense, and that her only way to get through this was to have weight loss surgery.
I don't know if you talked to this individual, can you share a little bit about what she had told this provider?
Absolutely.
And
so to give some background, previous athlete who was going to be a college athlete, so very fit individual, prior to that had gone through some disordered eating and was eating very little, was very, very small, not healthy, but went through being an athlete. She actually used to work out at a gym that I worked at locally. And so that's how we connected and stayed in touch. She was working out at my gym to prep herself to go to college. Well, she ended up having a baby. And so life changed, right? Yeah. Since then, she has gained a lot of weight and hasn't really been able to figure out fully why. It makes sense to have a little bit of that rebound, right? When we are living like an athlete, eating like an athlete, and then we're no longer an athlete. This happens a lot with college athletes in general, of getting used to eating what they were eating before and not slowing that down, but then their activity level drops drastically and all of a sudden weight gets put on. And so that likely was part of it, but it was too much. It was way, way more weight gain than made sense. Wow. So she's been trying to figure things out. She's asking questions and she's trying to figure out what she needs to be doing. And she's, very honest in saying that she knows that there are pieces of this that need to be fixed on her own, right? She needs to be working out again. She needs to be eating healthier again. And that's what she has started doing. Since we started having this conversation, she's lost over 10 pounds, which is great. It's definitely not the end of the road. She needs to lose a lot of weight. But I mean, and when I tell you college athlete, tall individual, muscularly built, I mean, based on apps and whatnot, looking at over 100 pounds, skeletal muscle mass versus a body weight of over 200 pounds.
Okay.
She has a lot of weight to lose and she knows that, but she's trying to do it the right way. But in the process, she's had doctors who have said that she needs to eat around 900 to 1,000 calories a day. That she doesn't need to exercise though, because of that, because we just need to get weight off quickly and not worry about exercising. Right. So, and this is not the first time I've heard this, that people will say to go extreme. And I say people, medical professionals will say to go very deep into a low calorie diet. And then they say, don't exercise because you won't have the energy to exercise. It's like, well, obviously
maybe this isn't okay then. Like maybe this is not the way that we should be doing this.
Right. Because they're so concerned with getting the weight off quickly, thinking that that's going to mitigate all of the health problems, but then it creates a bunch of health problems of its own. We know that, right? So she came to me and was like, I don't think that I can do this. And she wanted her to eat really just meat and like vegetables. And I think one like extra carb a day. Like she laid it all out for me. And I was like, that's like 900 calories. And she was like, I don't think I can do that. And I was like, I don't blame you.
Neither can most toddlers, sweetheart.
Yeah, like that's what I eat for breakfast. So like, so I was like, I would much rather you eat 500 to 600 calories more than that and start moving. Start moving, right?
Totally.
Work on, I was like, you don't have to do strength training yet, but just start being more active than you are now. So all she's been doing is been aiming for 8 to 10K steps a day, eating healthy. She's eating still probably less than what I would prefer her do, but she's not lifting or anything yet. She's just walking and being active, but it's been working, right? She's losing at a good rate of 1 to 2 pounds a week. Very perfectly normal, healthy.
Right. And to be clear, like that is on the faster end but she does have a decent amount of weight to lose as well. I just want to be clear for people out there who like,
absolutely.
The people maybe listening who are like, I'd like to lose 5 pounds. It doesn't, no, it's not going to be that quick for you, sweetheart.
Different. For example, like I'm in a cut right now and I have lost like between 5 to 7 pounds over the course of almost 12 weeks, right? That's about a pound a week even, because I don't have a ton of weight to lose. But if you do have excess body fat, if you're considered overweight or obese, losing more weight per week will happen, and it can happen. It's not normal for if you're trying to lose 10 to 15 pounds. It may not go that quickly, but she was losing a couple of pounds more earlier when she first started doing this. Now she said it slowed down to 1 to 2 pounds a week. And I said, that is perfectly normal, right? But again, this doctor just told her that essentially that she was lying. She went to her car and got the food that she had been prepped and everything and said, this is what I'm eating. And he said that she staged it. Yeah.
Okay. First of all, I think for people, I just came up with this while you were talking and I feel like it's really important. So I want to put it out there. If number one, your doctor gets zero nutrition training, medical providers in general, unless I'm not saying I'm some kind of fucking unicorn, but I kind of am a fucking unicorn in the medical community where it's like,
education.
Yes. And I have spent so much time really, really learning this stuff. And 9 out of 10 doctors have no idea what it's like to be a healthy human. Like, I'm just going to put it out there. Like, they just don't, they skip meals, they overwork, they don't have boundaries. Like if you're just talking like global health, they don't understand. And so I want to put that out there. And then I want to put this phrase out there to people who, when you talk to your doctor about weight loss or your weight, or they bring up your BMI or whatever said thing that is triggering, and they accuse you of you're not doing that. I would ask, or they put off some like ridiculous thing like, oh, you need to eat 900 calories. I would say, can you explain to me your qualifications of nutritional education for you to give me that advice? Like, what do you understand about nutrition? What training have you done? Have you done extra certifications or training programs that make you qualified to offer nutrition advice?
And I would even say, if you're not more assertive and that feels intimidating, because I'm going to say right now, I would feel comfortable saying that. Sure. I can see a lot of people not being comfortable saying that. Just simply ask why. Ask why. Start there and have them give you some explanation and just say, can you give me the reasoning why that doesn't seem like a lot of food, or that doesn't seem like, to me, that doesn't feel doable. Can we talk about options and see what they offer you at that point? Because you don't have to take it. It's not like that's the only option. It's not. And they may present it like it's the only option, but if you ask why, they should be able to provide you a reason. And if they can't, then you can say, thank you, but I'd love if you could refer me to a registered dietitian who can help me, understand this better. Right.
Yeah.
Because again, they don't get medical or they get medical training, but they don't get nutrition training.
None.
And if they have some, that's fantastic, but they have done it on their own. And again, you can ask about that.
Yeah.
They may have general knowledge of, it's good for us to eat fruits and vegetables. Fiber is good for you. You should be eating protein and whole foods. But most of us know that. You know that when you're going to your doctor. That's not typically the problem. The problem isn't that I should probably choose to cook the meal at home versus eating McDonald's. It's I'm struggling and I need to figure out a better solution to what needs to be done. So that's why we're having these conversations today, and why we wanted to chat is to talk about this advocacy issue, because it's intimidating when someone's got a PhD behind their name or a DR in front of their name. It's intimidating to question, but just because they are a doctor does not mean that they are knowledgeable on all things. Nobody is, right? PhD students are doctors and they are very fluent in their specific niche, right?
Yep.
But even if you talk to exercise and nutritional professionals who have PhDs in those fields, they will still tell you that they are in a specific lane, even within that. It's not all of exercise necessarily. It might be that they did their PhD in something very specific, looking at nutrition and cancer patients, or looking at older adults and osteoporosis and exercise, right? There's usually still a lot more nuance because they know where their education is, and they want to make sure that they're putting that out there. But just because it's a DR in front of their name doesn't mean that they are qualified to tell you those things. And if they are telling you those things, you can question why. So what we want to do is kind of talk through some scenarios today of some things that we've had people tell us, and how you can maybe approach those in a way that feels respectful to the doctor, but also is giving you a voice, right?
Yeah. I think asking why is a really good place to start. And with the eating thing, like, is this sustainable, or can you walk me through like a calculator to understand how much food that I need in a day? Or maybe even saying like, I've kind of read that, 12 to 1600 calories, that's like the caloric intake of a toddler. Like, I don't know if that's okay for me to be doing that, like things of that nature. And also, fingers crossed, hoping that the registered dietitian that they refer you to is like, not like some registered dietitians that I've worked with who are recommending 1500 calorie diets. It hurts my soul. I'm like, I have to do all this work on my own.
Yeah.
I'm like, I'm getting no assistance here. It's hard. But yeah, so I think, do you have any other like big points with like when doctors are like, I think this is a big one for a lot of people, is like pushing the weight loss surgery or pushing the weight loss pills like phentermine, which I won't write for. It's just, I have not seen a patient come to me who has gone on phentermine and kept the weight off. They all cycle with it. They lose the weight, they gain it back. I'm like, you're not learning anything.
Right. Right. Yeah. I mean, I think that typically what I hear, and I mean, I've had this happen to me, and in the last 2 years of my life, when I would say yes, at my heaviest weight, but not at my unhealthiest place in my life. The comment is comparing weight year over year, typically, or just taking the weight that you are, first off, when you weigh yourself at home, we're typically not like in shoes, in full clothing, maybe a jacket on, and they don't really care if you do that and take your shoes off and whatnot, unless you do it yourself. They don't tell you to typically at the doctor, but could add 5 to 6 pounds onto you. And they may say, oh, you've gained weight. Right. And I think the problem is there's not an appropriate response from doctors, sometimes nurses, but mostly the doctors saying, okay, so since last year, we've seen weight gain happen. Do you regularly diet and exercise? Like that doesn't even always happen.
No.
It's just we need to be exercising and dieting.
Right.
And
I hear
not
that all the time.
Question, right. It's not an ask. And sometimes there is an ask, but also it's just assumed that you're not, if you're gaining weight. And the assumption, when do we ever think that we should be assuming in the medical industry? That doesn't make sense, right? We have to ask questions. As a fitness and nutrition coach, I don't start working with someone until they filled out a very detailed questionnaire. And when you go to a doctor, your questionnaire may ask about like if you are doing any exercise and whatnot, but most of them don't. Most of them, it's just medical history, right?
It's very little of the, like ours definitely does. I hammer it pretty hard, but like, it's like, sure. How many minutes a week do you exercise? And like some people, I had a girl today say that she works out 40 hours a week because she walks at work. And I'm like, those are different things. Like, yeah. And I explain that to people and they look at me like, you know, I go through like the TDEE with people and be like, okay, like this is great that you're doing this, but we need to understand the difference. And then they just get cranky. And I'm like,
well, and there's a difference in exercise, like structured exercise versus just movement, daily Correct. Movement, not being sedentary. So that's the first thing that I would say I hear the most is that doctors just make assumptions that if you have weight to lose, that you must not be eating well and you must not be exercising. And so if that's the comment that you're getting is, well, you need to diet and exercise. If you are doing those things, you don't have to keep your mouth shut at that point. You are allowed to talk to them and say, actually, this is what I'm currently doing, right? So when the doctor did it to me, I had an OB do it to me. And it was year 2 of seeing her. I got a new OB when I moved to the area I'm in now. She doesn't have my full history or anything, so she doesn't know my background. Growing up, my OB was fantastic. He knew my family, my sisters. He delivered my niece and nephew, like knew us. So he was not worried about if my weight was fluctuating while I was in my 20s because he also knew I was very active. But she said, you know, I've seen you gained weight since last year. You know, the pandemic hit everybody pretty hard with, you know, not moving as much and food and whatnot, like just kind of went into this thing already without asking me why I had gained weight. And I worked out more than most people during the pandemic. We have a full home gym. I had friends come to my house to work out. I was doing online fitness classes 8 times a week, where I was working out for more than half of the workout. Some days I was doing 2 workouts a day to be teaching these classes, right? Because I was exercising with them and I wouldn't always fully do the exercise with them, but I was still probably, like I said, at least 50% of the time I was moving along with them. Mm-hmm. She didn't ask any of that. So my response was, I said, actually, I've been working out the entire pandemic. I haven't had any trouble with getting in exercise. I have a full home gym. I actually intentionally was gaining weight. I was eating enough food for the first time because I wasn't at work and not having time to eat. And I've been working on gaining muscle. I've been lifting 4 to 5 times a week. And she was like, oh, well, that's great. And like, that was the end of the conversation.
Oh, wow.
So it made her be quiet, but it very much, to me, it set me off. And that was the first time I said something about it on social media and got a plethora of responses of getting that. So you are allowed to tell your doctors what you're doing. Just because they make an assumption about you, especially if it's not true, tell them what you're doing.
Say something. Yeah. Mm-hmm.
Yeah.
100%.
And you don't have to say, well, actually, this is what I'm doing. Just say, well, you know, I do exercise regularly. I'm working out 3 times a week doing strength training. And I make sure I walk 8 to 10K steps a day, or if it's 6 to 7K steps a day, which is still per health minimums, great to be doing, and make sure that they're aware. Right. Because I do think that the reason most doctors also continue on that assumption is because people don't stop them and correct them.
I agree 100%. I agree 100% because I have people come to me all the time and they're like, I'm sorry for asking so many questions. And I'm like, it's kind of in my job description to like answer your questions. So like, don't feel bad about that. And if a doctor is making you feel bad about that, you can leave. Like you can see someone else. Cause yeah, that's not cool.
You also don't have to be weighed at the doctor if you don't want to be. You are absolutely allowed to. And there's a lot of stuff I've been seeing, at least, that people are starting to say, like, I don't want to be weighed. You can like check something off to say like, I prefer not to, or you can just say, hey, I don't prefer to be weighed today.
I have a story about that that fits in with this. So our dietitian actually did like who recommends very low calories, but I thought that this part of what he said was very useful. He talked about how it's very difficult for people who go to doctors who are overweight to be weighed, and like what kind of stigma that can create for them. And it can just make them feel very uncomfortable and not want to come back to you and trust you and talk to you. And I'm like, and in my head, I'm going, yes, yes, yes. Like all of this is really important, right? And I'm just saying this as someone, as an observer, because I've never been overweight myself. Like I don't know what that's like. But I feel like I've done enough psychology education to kind of understand that. And so one of my counterparts said something, and they said along the lines of like, oh, it's like great for our metrics. You have all these people like denying to be weighed or whatever. And I like stopped him right there. And I said, I give my patients the option in my practice. I said, because I stand out where they weigh themselves and all I hear is negative talk with that stupid scale. I said, people who are overweight know that they're overweight. They don't need me berating them or another judgment or anything else about it. I said, so after their first visit, I weigh them the first time they come in. And then after that, the question is, would you like to step on the scale today in my practice? And you could have heard a pin drop in that room with those physicians. And I was like, you know what, I'm done. Like, there are so many different things that like perspectives that I have that I feel like make me the provider that I am. And I feel like the people who come to me and stay with me appreciate, but that just goes to show you, I think, the typical mindset of the physician. Like they just think it's ridiculous. Like they don't have any respect for like what might be going on for someone that they may not want to be weighed. Like, do you have a previous eating disorder and that's really a trigger for you? Are you trying to lose weight and you're really struggling? Is that like all of your self-worth and you're really trying to stop weighing yourself I mean, there's just so many different things that go into that.
There are. And I do think that at times it has to do with, again, just kind of the brokenness of the system, in that if you only have a set amount of time with a patient, how much do you consider them to be a human being? And I don't want that to sound horrible on doctors' parts. I mean, the fact that the doctor does not have a lot of time with you. So they are looking at data and trying to consume as much data as possible and get in there and figure out whatever they can in that time frame. And again, I don't think that that's the right way to go about it, but I think it's just caused this, like, that's the thought process of like, well, I don't have their weight. I don't have XYZ, if they're going to not do all this, why are they coming in? And again, I don't think that's right, but I almost feel like our system has just continued to gear towards like dehumanizing people and not worrying about the emotional effects that it has. But like, how many people have I heard come out of doctor's appointments and they're like crying?
Yeah.
Right. Like, because they're so distraught over what was said to them and they felt like they weren't allowed to say something, or they didn't feel comfortable saying something. And that's not the environment that it should be. If someone's coming to you because they have a health issue or they're trying to better their health, they should be in the most comfortable place they could be. And yet people dread going to the doctor.
They do.
Dread it. And it's like, people wonder why. I mean, my dad was a doctor, and I know that my dad was very much the way he was because he wanted to make sure people felt heard as a whole person. Yeah. Like, and not everyone's like that, but these horror stories come out and you want to know why people don't want to go to the doctor. Like, that is why. I read up on the doctor that this poor girl that, messaged me and is planning to work with me in the future. I read up on his page and his reviews, and there were a couple of good ones thrown in there. And then most of them were saying the same thing: recommended weight loss surgery very quickly. Didn't give me respect or time of day, told me that I wasn't doing my medications right. Like, blamed it on that versus, if something wasn't going right. And it's like, I understand that there's people out there who are not doing what they should be doing. When the doctor says 100% do this, but that doesn't mean that you should have reasonable doubt for everybody. You should ask questions to figure out, because 9 times out of 10, if someone's not taking their medication, after a while, like, if you ask enough questions, like, you're either going to catch them in it or they're going to be like, okay, you're right. Like I probably missed a couple doses or something, right? Like we get uncomfortable when we're lying about situations. So like, we're going to come clean, especially to a doctor. Right. But it shouldn't be the assumption.
Right.
The assumption should not be this person's lying to me. Right. Yeah.
Mm-hmm.
So I don't know if you want to talk through a couple of different stuff, like things that you got, or I can talk to you about a couple that I received and we can.
I mean, I think that one of the biggest ones is women getting their hormones tested. And I know that this is like I don't know if you got any responses about that or.
I had something about birth control, and side effects of birth control. So
okay.
we can talk about that.
Yeah, I can segue into that. But I think one of the biggest things is I hear a lot of medical providers say that like, oh, women don't need to have their hormones tested, or it's just too finicky, so I don't bother. Things like that. And I think, a couple of things that you may be able to say to your doctor are, well, I know as my hormones fluctuate that my mood fluctuates. Like, what about PMS and PMDD? Like, those are ICD-10 diagnoses, which means an ICD-10 code is like the things that we can code to get reimbursed. So, if it's affecting my emotional well-being, is it not affecting the rest of my body? Or, I've read that, estrogen can be really important to my bone and cardiac and brain health and my emotional well-being and my joint health. So like telling the doctor that you understand that your hormones are important more than just for having a baby, because I think a lot of women will get the experience of, well, are you trying to get pregnant? Then just go on the birth control pill. And it's like, wait a second, like, would you give a man a pill that shut down his testosterone if he was interested in his hormone testing? Like, I don't think that we would.
Right.
So, and me personally, I would say that to someone. I know that not everybody would, but I think, if you can demonstrate some knowledge to doctors, like it's very easy for me to tell someone who's done their research or
right.
someone who has medical education, because they ask very insightful questions. So if you're able to ask like insightful questions about your hormone health, like, hey, I heard that progesterone is really important for, my mental health. It increases the GABA in my brain and it helps keep my uterine lining intact. And it, does X, Y, and Z. Like those are some information that is some information that you can offer. Or with testosterone, with your libido and your mood and your energy and your body composition. So mentioning those things to your doctor or your medical provider, again, and I will put a disclaimer on this episode, but this is not medical advice. This is just general information that you can go back to your doctor and say, hey, I understand these things. All of these things are impacted by my hormones. So can you explain to me why that's not important to my overall health and why you think that testing this isn't important? And
I would say again, I'm not playing devil's advocate, but I'm playing the more timid person.
Yeah, no, I think that's so important. I have a hard time with that.
Yeah. Danielle and I are both very forward people that will speak our minds. And so that's why we wanted to talk about this. But I also am wanting to bring this around to the person who's not that way. If you don't feel comfortable, like remembering all of this information, right? Simply doing a little bit of research before you go in, whether you write it down in a notebook, on your phone, right? Whether you print it out, but just say, hey, I've been looking at research, or, I've been reading some articles about this. Can you explain it a little bit more to me in detail? Because you can even say, I wasn't quite sure what all of this meant, but it has me interested in testing my hormones because I'm noticing some of these things happening. And from what I've read, blah, blah, blah. Right. So you don't have to necessarily question their judgment, but you can say, this is something I want, and this is why. A doctor shouldn't deny you your desire to test anything. I had a doctor, again, this happened in the last year, where I called and was asking about getting an updated lipid panel because my cholesterol is something I've been paying attention to. It runs in my family to have high cholesterol, and I had borderline high cholesterol. So I made a bunch of adjustments. I was working on like my food intake, where my protein sources were coming from, increasing my fiber intake, right? Doing all the things that I knew would be beneficial for this. So it had been 3.5 months. And I had also consulted with the RD on our team on level 10 coaching. I consulted with Ariana on this and just, ran some things by her. What do you think I should be implementing? Does this sound like a good plan? So we came up with a plan for me to work on this. So 3.5 months, she told me that I would definitely see changes. If those things were impacting it, I would see changes in my cholesterol. Great. I wanted to schedule that, and I received a call back initially telling me that I didn't need it because I had already had it done just last fall. So I had to say, hey, I know that I don't need it per the annual. However, this is something I want because I'm being proactive about my health. It was borderline high when I came in the fall. I've made some dietary changes and I'd like to see if it's impacting it. Once I said that, there was no question.
Awesome.
Because I had just simply put that information out there to say, this is something I want, and here's why. So if you can find a reason as to why, whether it's your coach has talked to you about it, whether you're just interested on your own and something not seeming right, if it's birth control making you cause weight, if it is, you are feeling really run down a lot of the time and you can't figure out why, and you're feeling like you have to sleep all the time and you're sleeping 10 to 12 hours and you don't have energy even on the weekends when you sleep in, you're allowed to ask why. Hey, I'm wondering if it's maybe my cortisol that's playing a role, right? I mean, if you search fatigue and tiredness on Google, cortisol is probably going to come up. Yeah. So a simple Google search may give you some starting points, and then you can bring that to your doctor to ask. Now, again, if they deny you getting that, then you can say, okay, can you tell me why you won't let me get it? Like, I'd really appreciate if you would get this run for me. Again, the girl that I was talking about, that first person I referenced, had to beg for a test, and she did. And I was so freaking proud of her for begging for this test, but she had to beg for this test, and you shouldn't have to do that. No. She's seeing a new doctor this summer, but good
for her,
you can ask for it. And even if they say no, you can say, I understand that you don't think this is necessary, but this is something that I'd really like to make sure is okay. Right. You don't even have to say that, like, I think you're wrong or something, because you may not know. You may not know. You may say it would just give me peace of mind.
Yeah.
And if at the end of the day, you're the one paying for it, or it's coming out of pocket, or insurance covers it, then like, it's nothing bothering that doctor, right, to get it done. They're probably also not the one even taking the time to do it. It's a phlebotomist somewhere else who's doing it anyways. So it's just them having to write it off to say it's approved, right?
Order.
So,
yeah, it's just an order. And right. I mean, there are limits to, like, I mean, and I know that you're not talking about this, but like, there are times when I'm like, maybe we don't need an MRI of our low back just yet.
Sure.
So I just like to make that clear that there are, like, I like to be conservative with like medical costs too. I don't think that a lot of medical practitioners pay attention to that, but a lot of the times, like, I had this one lady come in who wanted a chest x-ray, and I'm like, why the hell does this lady want a chest x-ray? Long story short, she had this friend who had this super rare disease, and she was ruminating on it. It was impacting her life. And I'm like, okay, the radiation and the cost of this test is probably worth this woman's like mental well-being at this point. Like, she was just struggling. I'll never forget her. I was like, do you know how rare that disease is? And she was like, I know, but I just can't stop thinking about it. And so we just did a chest x-ray, $100, a little bit of radiation, like, probably worth it for her.
Right. So you're allowed to advocate and ask. And if they say no, you can ask why. And if they can't give you a good reason, that's more of a reason for you to say, okay, well, then I'd like to go ahead with it. And if they do give you a good reason, then say, okay, do you think it's something we could revisit in a month if I'm still feeling like it's something that hasn't changed, right? Or if I'm going to implement these other things that you're suggesting versus that, right? If you think, like I said, if you're feeling super stressed, whatever, and you're wanting to get a cortisol test, or you're wanting to get your cholesterol checked, whatever, you are absolutely allowed to say, I'd love to like revisit this if things haven't changed in the next month or two.
Yeah.
If you're willing to wait, right? So again, you don't have to be accusatory, but asking questions and coming off from a place of wanting to do it for your own health, I think opens the door a little bit to doctors to be more open-minded. It helps them not feel like they're being pushed back on, but more so, okay, let me see if I can do something to help this person. It seems to go much better and much smoother when we do it that way. And not that you shouldn't have to tiptoe around it, but again, we have to think about what's going to be best for you at the end of the day. If it's going to get you what you're trying to get, find the respectful way to ask why and how come, and, get a little deeper.
And I think a lot of these tests and things that doctors are kind of a lot of the times very hesitant towards are some of the more like, you don't need to do that labs, like cortisol levels, like, or hormones, like some of, my doctors that I work with probably don't even know what a GI map or somebody brought in a Dutch test result for one of the doctors in my clinic. And I'm like, they are not going to even know what to do with that. Like, you should just have that person see me. Like,
yeah.
But I'm curious, what was the, since we're kind of like on gynecology, what was the birth control thing that you got?
So a friend of mine said that her OB said that the IUD would not cause her to gain weight. Immediately after taking it, she gained weight. And when she expressed concern, she basically accused my friend of it being lifestyle, that like she wasn't doing anything to help that, which is one of those things where it's like, again, why are we assuming that it's because, oh, she hasn't been working out as much or she's not eating as well or anything like that? She didn't ask any questions. So she was just really frustrated with, you didn't even ask me about if my lifestyle had changed. You just assumed, oh, it's lifestyle stuff. Like we're not moving as much. We're not eating as well. Then that's why we're seeing weight gain. When in reality, we see a plethora of different things happen when people go on birth control, and it may not be a direct insert birth control here, insert weight gain here, but it's typically a insert birth control here, different things in the body start to happen. And then weight gain happens because of those things, right? So it's this indirect route. Typically, it's not this causes that, it's this causes these things. And then because of those things, which could be, you don't enjoy moving as much because your hormones are shut down. You don't enjoy getting outside as much because your hormones are shut down. Your emotions are very different because your hormones are shut down. And now all of a sudden you're a very different person.
Yeah.
And maybe that's why your lifestyle has changed. But it's not just because you wanted your lifestyle to change. It's because your hormones are doing something completely different. They're completely shut off, or they're very, very low compared to what they were. And so those things aren't discussed. Typically, it's just an assumption of, and I can say, I mean, my mom was like concerned in high school. I remember this vividly, her being like, why have you gained weight? Not in a like thought that I gained weight, but she was concerned that other things were going on. You know what I'm saying? But I was like, no, but it wasn't any of that. But it was because of being on birth control, and nobody.
And to be clear, like any of the hormonal contraceptives can cause weight gain. And I don't know the exact statistics of the percentages or numbers or anything like that, but in my clinical practice, what I have noticed is the depot shot is the worst. Like 100%. But I have seen women on levonorgestrel IUDs, which is Kyla, Skylina, or Mirena. I have seen them gain weight. I've not really paid attention or seen it too much in the copper IUD. And then of course on the birth control pill, I have definitely seen it. So I feel like a lot of symptoms that women go to their doctor and say, hey, I've experienced X, Y, or Z since going on birth control. I think it's from the birth control. They're like, oh no, it can't do that. So you get like this like tisk no. And it's again, like, why so dismissive? Like it's that, have you read the package insert is my question to them. And again, like, I guess I do have a harder time going on the more timid end of things, because I would say that to someone. I would say, have you read the warning label? Have you read the package insert? Because this is a listed side effect. Like I went, maybe saying something, in a less snarky way of, hey, like I went to the manufacturer's website and this was actually a listed side effect and this is happening to me. So I have concerns. Like, can we try a different pill, or can, I mean, I think everyone knows how I feel about hormones and how important they are. I would love if everyone just used the fertility awareness method, but I understand that's not realistic for everybody. Like, girl, you do you, like whatever you have to do. I only judge you if you don't like puppies. It's a problem. It
is a problem.
It's so real. But, saying something like that of like, I went to the manufacturer's website. I noticed that this is a listed side effect. Like, can we try something else? Or I'd like to try the fertility awareness method. Can you teach me about this? Or can you show me to the right person? I had a friend who I've told this story before, but since we're like directly talking about like doctor's experiences, I think she had the Kylina or the Skyla IUD. I can't remember which one. She had previously been on an oral contraceptive. She was sexually active, young girl in her 20s, very active, super healthy, like think ideal level 10 client healthy. Okay. And all of a sudden she started getting all of these UTIs when she got the IUD put in, and she just didn't want to take a pill anymore, which, girlfriend, I get it. And so she got this IUD put in, and like a month later, she started having all of these urinary tract infections. She had never had a UTI in her life. not a single one. And then she was getting kidney pain, like legit kidney pain, kidney infections, had all of these courses of antibiotics, which of course then, impact your gut microbiome, which impact your cycle, and your estrogen levels and all kinds of things. And she's a friend of mine. And she said, Danielle, I don't know what to do. And I asked her, I said, did you have these problems on your old birth control pill? She said, no, I did not. I said, if I were you, because let me back up one second. She actually went to a urologist because this was getting so bad. And they said, we found an anatomical abnormality in your ureter. We need to do surgery.
Oh my.
Probably just it's probably just an anatomical variant. Like people, if you ever done a cadaver lab, like every different cadaver looks different. Like
sure.
I call it an incidentaloma. Like it was just there her whole life. Right.
Right.
And I said, if I were you, because she's like, I don't want to have surgery, She's like, what do I do? I said, I would get that IUD taken out and I would go back to your old birth control pill because that was not causing you any problems that we know about. So long story short, she had the IUD pulled out, not a single other UTI. Don't tell me it wasn't that damn IUD.
Yeah.
So, had she not had me or someone else in the medical field who understood that stuff, like she probably, who knows what she would have done, but that's
surgery. Yeah. And I think that's something that people don't realize is, and not just with birth control, but any medication, if a dosage is not feeling good to you, that is something you can immediately call your doctor's office about and be like, hey, something doesn't feel right. Right. So like I was prescribed anxiety medication when I was in high school and I was happy to go on it. I was stressing out. I was crying. I was getting in fights with my mom because I couldn't handle life. Right. it was too much. And if it got to be too much, I would just start crying and not be able to get anything done. And it was not fun. And I went to a doctor, I got put on anxiety medication and I was thinking, okay, this is going to help. And I was falling asleep, sitting up in my bed with a book in my lap, lights on in my house, like as a, 15, 16-year-old girl.
Not okay.
Not like chronically fatigued or something from, 80-hour work weeks. It was, I went to school and then had practice and had to do my AP biology homework, but I was falling asleep with a book in my lap. Like I remember, I have a vivid memory of specifically one time my mom coming in and being like, are you okay? Because I like woke back up and had my biology book sitting in my lap, lights completely on. And I am terrible at sleeping with lights on. Terrible.
Same.
Okay. Like I have to wear an eye mask. It doesn't work. I changed the dosage. They lowered it. That was fine. It was all because the dosage was just too high. And so, you don't think about those small things, but they may just not get the dosage right the right time. The first time it may be that you need a little bit more or a little bit less. I have a friend who has had chronic issues just in general with like her menstrual cycle, bleeding more days of the month than not. And what's working for her now has been fantastic, but it's like the very lowest low dose IUD is what's working for her. At one point they had her on like 80 milligrams of estrogen or something. And they just kept increasing it, thinking this will help it. This will help it. This will help it. She gained weight. She talks about it now, where it was completely different. Her body was completely different. And now she's super healthy. She strength trains multiple times a week, gets 7,000 to 8,000 steps a day, if not more. She's very happy. A lot of the issues have gone down a lot, but it was changing from estrogen to a progestin only and a very, very low dose. And it took a while, but also I don't know why they thought that they needed to go up that much with the estrogen, but either way, it took a while. And then eventually finding the right thing was good.
Yeah.
But it may not happen the first time. So that's another piece that you can advocate on is if it's not feeling good, talk to your doctor.
God, please don't wait. Like I tell all of my patients when I start them on new medications, first of all, I bring people back after starting them on new meds in 2 weeks, even though with like depression, anxiety medication, like it's not technically soon enough to see a difference. Right. I do it anyway. Part of it's CYA. I want to make sure that like no one's having a nasty side effect, even though I go through like a whole, like, these are the side effects, like, please call me. Stop if you experience these side effects and it isn't to please stop the medication and call me. People don't. They wait it out. They're like, oh, well, I just I didn't know. And I'm like, but I told you, like, I told you not to do that to yourself. Like, there are so many other options that we can use.
Yeah.
So
Especially if it's like
please.
serious things coming, because
Yeah.
there's some medications that are fantastic with what they do and when they help people, but there's also some that cause very drastic side effects. Like there are birth
Yes.
control issues that people have had where they're getting suicidal thoughts. There was a medication that when I was interning and looking at different doctors' offices when I was younger, I was doing like many internships with doctors locally to try to figure out, get more hours in and what I wanted to do. And along with that, I was at my pulmonologist, because I had asthma growing up. And there was a drug that they were using for asthma patients that had the severe side effect of causing suicidal thoughts.
Oh, wow.
Yeah. And I mean, it has nothing, you think, what
An
in the
asthma
world?
med?
Which is crazy, right? But you wouldn't think anything of that, but it's something that happens. So I mean, believe me, when they were administering it and whatnot, they're very clear. Like, if you have any kind of thoughts that are worse than they normally are, immediately stop taking medication and let us know. It's a very, very small percentage, but a very
Well, that happens with
that
happens with like SSRIs too, so, and antidepressant medications, antidepressant or anxiety medications. And I've seen it twice into my 8th year of practice, that someone has had suicidal ideation on these medications. So I tell every single patient, there's a black box warning for suicidal ideation. If you experience this, please stop the medication. Yeah, and you wouldn't think that from like a depression med, but what happens is it's mostly seen in people who are so depressed that they wouldn't have the energy to kind of like harm themselves or think about harming themselves, that they get a little bit of energy and they start like having those kind of
depressive thoughts haven't gone away, but they've got enough energy for that.
Yep. Yeah. So, please don't wait to tell your doctor, your medical provider about any type of adverse effects that you're having from any medication. That's really good information.
And if they're dismissive, talk to somebody else.
100%. Go ahead.
I was just saying, that if that doctor, usually a doctor, a lot of times they're within a practice, you can request to switch to another doctor in a practice. You do not have to talk to your doctor to tell them that either. You can talk to nurses and say, hey, I'd like to see somebody else in this practice. And you don't have to give them a reason, or if you want to give a reason, you can, but you can just say, hey, I'd like to switch doctors. Is there somebody else who has availability? And leave it at that. They may ask why, because there's probably something in there that they're supposed to ask, why are you switching? Maybe, but in
our office, I don't know how it is in other offices, but you can't really provider hop. Like, you can see one other provider, and then like you're not really allowed to kind of just like, if you don't like someone, like try out everybody. But we do, like, because I'm not for everybody, and I tell people that, like, but also when you call to make the appointment, like, that front office staff knows their providers. Like, if it's a teenage girl coming in for like mental health stuff, like they give them to me, like 100%, because that's like my bread and butter. Right. So asking like, hey, do you have someone who's like, I think most of the people listening to this are a little bit more natural minded and want some things like, hey, I want to test my vitamin levels and some, other obscure things. But so asking, hey, do you have someone who's like more naturopathic or who understands more about hormones, or, maybe works with like does more women's health stuff. So like asking those questions, the front office staff knows, man, those girls, they know me up there. Like, they know me really well. So I feel like it's almost like you guys do with level 10, like how Danielle will match you guys with the right person.
Gotta find the right fit. Yeah.
I mean, stay on the phone with that front office person and ask them, hey, can I ask you a couple of questions about your providers? And, who would you recommend for this? Like, our one gal, Michelle, she comes back all the time. Like, oh, I talked to this mom and she has this, 16 or 17-year-old girl. And I think she'd be really great for you. Like, they just know. So, yeah, absolutely. Putting those questions forward, I think, to the front office staff before you even step in with the provider, can be really helpful. And they'll tell you too, like, they don't got shit to lose. Like, you know what I mean? Yeah.
And I mean, they want you to get the best care. And if they are, again, you may end up with somebody who like, is like, oh, we just assign to whoever's available. But if you are not in a hurry for certain things, maybe you can wait an extra month to see somebody who you think would be a better fit. And I understand that insurance and all that kind of stuff will come into play, but within a practice, typically, like if you're already looking into that
mostly
practice,
same insurance,
most of them should be the same insurance to cover that. So again, another thing to like, just reiterate, you are allowed to ask about, based on what your needs are, who do you think would be a good fit? Right. I mean, how often do we look through multiple different reviews for restaurants to see if it's where you want to go eat, or for, cell phone service. You look at reviews and figure out what do you need, and do they provide what you need? And that can also be looking into how they practice, and if they normally work with people who are doing or needing what you need. For example, when I was looking at mine, looking at if they have other specifications or specializations, to me was important. You can a lot of times see that stuff online, and if you can't, give a call, right? Just make sure to ask, and know that you're not wrong in asking questions at all.
What other questions did you get? Did you get anything else?
This one's just kind of, I think, important in that kind of reiterating the not having nutrition education.
Yeah.
Somebody having weight loss, doctor asking how they did it, and when they said calorie deficit, she said, "What's that?"
Oh.
So that's just kind of a side random one to throw in there. But again, caloric deficits, people don't even necessarily put together that's eating less food. But again, I feel like that makes sense. But if you've never heard the term, maybe you don't think that. So again, just to reiterate, not getting nutrition education in a medical degree, and that is normal. I have one that said, because I'm in college, my doctors don't believe that I eat healthy, even when I tell them with actual data. So again, just an assumption piece of, because I'm in college, I must be, drinking heavily, eating like garbage. I couldn't possibly be caring about my health at this age. Which of course is frustrating. I mean, I started getting into CrossFit when I was in college. I definitely had some years of being the typical college kid first, but I got into being healthy basically for the second half of my college career. This one's not in, it doesn't necessarily mesh with the ordering tests and whatnot, but had someone say their fiance had loose body, so bone fragments in their shoulder, and the doctor just said, just deal with it and not having any treatment to it, which I don't have as much background on that, but it also still doesn't sound like the right way to approach it, even if there isn't anything that can be done for that. I don't know if you have any knowledge on that.
I don't. I have a friend who works in trauma surgery, and she's probably like, how don't you know about this? What is it? Loose bony fragments? What is it?
Yeah. Essentially like bone fragments, I guess, that had been picked off or something in the shoulder. And they were just like, you just have to deal, which that may be the truth.
So is that from an avulsion fracture?
I was shorthand, so I'm not sure exactly the details. I'm assuming that there's a good chance that maybe they can't go in to remove small little pieces, but I don't think it was handled well in how the delivery
Yeah.
went.
So, I mean, I think in this case, if there's not something surgical that can be done with, because this is like an orthopedic thing, and I'm going to assume that this was an avulsion fracture, and I could be wrong. And if my friend Chrissy listens to this, she's going to be like, oh God, because she's a trauma PA, and I always text her with all of my ortho questions. Because it is definitely not my, ortho is not my strong suit. I'm just
again, very specialized.
Do I splint this? Which splint do I use? I don't. Is it emergent? Are you okay? There's tons of stuff I don't know, but if there was an avulsion fracture, I mean, those are typically treated depending on the location. They're usually just a sling with the arm, and then physical therapy. But if you're seeing an orthopedic surgeon, which it's maybe sounds like this was saying things like, well, do you think physical therapy would benefit? Or if there's not a surgical option, is there something else that you can suggest? Or, something that I even said to my oral surgeon today was because I need some gum grafting on several teeth, but, I actually really liked him. He tolerated all of my questions really well. I berated him with questions. And something I said to him was, if this was your loved one, if this was your wife or your daughter or your sister or your brother, would you tell them to have the surgery because you thought it was the best option for their health? And he said yes. And I was like, okay, can you tell me why? So I think saying something in this aspect when something wasn't being done, can you tell me why this is the best option? Can you tell me that this isn't going to have negative impacts down the road if we don't do something about this right now? So asking those negatives too, as to we kind of talked about well, why should we do this, or why shouldn't I do this? Kind of the same thing with in that realm of, what can I experience on it? What's the worst case scenario?
Sure.
And I mean, the worst case scenarios are a small percentage, but it's still a chance,
Well, so you should be informed, right? when you go into surgery, they typically try to, tell you what the outcome should be, worst case scenario type of things. If they're not telling you that, you can definitely ask. And I really like the verbiage of, can you explain this further? Because it shows interest and doesn't feel like it's attacking, right? Yeah. And I know that doctors probably, I mean, my mom's a nurse and she hears it, they get some very negative stuff thrown at them, and that's not appropriate. I'm not saying to do any of that, but can you explain further? I don't fully understand this, and I'd really love to. Can you explain a little bit more as to why this is the best option and why the other option is not great? Being respectful in how you ask for more information, but at the end of the day, I mean, it's always ask for more information. Yeah. I also got another response about, basically PCOS not being identified for a couple of years because of being told that levels were fine, right? And guys, remember that levels being fine is not the same as them being optimal, right? And you falling within a range doesn't mean that it couldn't be headed in the wrong direction. If you're on the low end or the high end of something, right, that could be a sign that it's heading towards not being in normal range, but it's also maybe not in optimal range. And optimal is really where we'd like people to be.
And I'd be curious as to what, like, are you talking about testosterone, or there's other androgens
This one was someone who was diagnosed with PCOS so she was misdiagnosed for 2 years, went to the doctor, several of them, for weight gain, 80 pounds in 2 years. It's no small amount. Again, I know that lifestyle can make this happen, but also not a small amount of weight gain, right? This isn't 10 pounds. This is 80 pounds in 2 years. Still moving her body, still eating right, still gaining. Moods were off, told her hormones were fine because they were within the ranges, like normal ranges. She said she didn't know what to do because doctors didn't believe her. Finally found a doctor who looked at the whole picture, and then was in this past January diagnosed with PCOS with insulin resistance. Okay. How insulin resistance was missed prior, kind of.
That should be, I mean, when I'm thinking PCOS, if I really have a high suspicion for PCOS, I'm definitely looking at your fasting insulin levels. Right? I'm 100% going to be looking at that.
I just wonder if they were like saying it was within range and it was on the high end, but they were like, well, she's overweight, so it makes sense that it's on the higher end, instead of it being that the higher end insulin resistance may be causing the weight gain. You know what I mean? Like, I almost feel like they're saying, no, it's because she's not eating right. She's not moving. She's gaining weight. That's why.
So they had waited to check her insulin levels, I guess, is what.
It was a different doctor. She went to multiple doctors. So again, great job to advocate for yourself and go to a different doctor when you weren't getting answers. I hate that it took 2 years.
Yeah. So the average time for diagnosis for PCOS and endometriosis, some women, it's like, endometriosis, it's like 10 years. I just interviewed a girl who's yesterday for the podcast. She's going to talk about her multiple sclerosis diagnosis and stuff. And that's another one that takes a long time. But I would also wonder if I was just I wanted to double check myself, because I always have to look up the testosterones because there's several of them, and I don't want to misspeak, but I wonder if, her DHT would have been high if her testosterone was normal, because DHT is very potent.
And I can,
things like that.
There's a good chance too. I just feel like that those things maybe weren't even
weren't checked, because that's not even a first thing that I check.
Right.
If I go through, your thyroid and your cortisol and, your testosterone. And when I say testosterone, it needs to be a total, a free, a bioavailable, and a sex hormone binding globulin panel. If I go through that and that's normal, and your fasting insulin is normal, and I still have a high suspicion, because ultrasound alone is not sufficient for diagnosis for PCOS. Say that again. Ultrasound alone is not sufficient for diagnosis or exclusion of PCOS. So you can have cis and not have PCOS, and you can have PCOS without cis. Because it is guys can go back and listen to my episode with the PCOS doc. We talked a ton about PCOS, obviously. But yeah, so just even knowing what your doctor's ordering, like asking questions, like, how are you evaluating for this? And how is a diagnosis actually made, or what's the gold standard diagnostic evaluation for that? Because that's how we kind of talk in medicine, is like, this is the gold standard. Like with endometriosis, it's an exploratory laparotomy. Like that's women come to me all the time and say, I was diagnosed with endo. And I'm like, how was that diagnosis made? And they're like, oh, they did an ultrasound. And I'm like,
That's not it.
So that might be a good question and helpful for people, is like, if you're worried about, a specific diagnoses, like doing some research on your own and knowing what labs that you need and letting the doctor kind of do their thing. And, just asking them before you leave, I've done some research, and can you tell me what labs you're going to order? Like, I just want to make sure I understand like what's going on, and from my understanding, like my perspective type thing.
Yes, absolutely. And I think it's just going to be something that you will have to overcome a little bit of the anxiety and understand that doctors are humans.
Yep.
And they are just another person to be talking to. And yes, they have education in certain areas, but if what you are talking about, and not even that it has to be that, but when it comes specifically, I would say, to weight loss, nutrition, health, exercise, understand where their limitations are at and be okay with advocating for yourself on those.
Yep.
Let them know what you're doing. Hey, I just wanted to update you on what I'm doing, right?
Yep.
I want to let you know, because if they have at least that understanding, this is what you've been working on, great. And I'll tell you right now, there's still going to be some people who have the assumptions of, I don't believe you because you're overweight or whatever it may be. And we cannot change what other people think in that capacity. But doctors should, at the end of the day, put those things aside. If you are telling them, hey, this is what I'm doing, I have no reason to lie to you about this. But if a doctor is accusing you of lying and you're not, and I mean, be truthful with yourself. Don't tell them that you're exercising 3 times a week and you're not. Okay. But if you're telling them the truth and they are not,
because we know when people are actually lying too. Like,
yeah,
I can sniff that.
Yeah. That's the time that you leave. Okay. And there's nothing wrong with leaving a doctor's office and saying, unfortunately, I don't think that this is the right fit for me anymore. And again, you don't even have to tell them. That's the wonderful thing about it. Doctors lose patients to people moving, changing insurance all the time, where I'm going to be honest, there's a good chance that they're not going to be worried about why you left. And that's, of course we'd love to stop other people from going to them, but take care of yourself first and understand that's the first priority. So I know we're kind of coming up on time. I don't know if you have any other specific situations you wanted to talk about.
I've gotten a couple. This one, I'm kind of reading through it. What to do when they dismiss you because you look like you're lying. Dude, like all of these people, I cannot get over this. I've always struggled with body comp despite working my ass off in the gym and eating a pretty good diet. I've gotten blown off by the doctor after doc because I didn't look like I did those things. Got told to eat less, work out more, blah, blah, blah. So she has more, I don't even know who this person is. I just kind of screenshotted it. Mm-hmm. But I hear this in my doctor's office all the time. Like my medical assistant gives very specific advice. Like, if you have high cholesterol, I'm giving you resources for fiber and foods rich in nutrients, and telling you to walk after meals and eating less processed food, and explaining like what a nutrient dense food is. Like, pull it off a tree, pick it out of the ground, kill it, or it's going to grow mold in your house in a couple of weeks. So that people grasp an understanding, because I think when doctors are telling patients, just work on diet and exercise. Well, what in the fuck does that actually mean? Like, so many people don't, that's so unhelpful. And it's just so much more confusing, and it gets lost in this vast pool of like they hang up the phone and they don't even think about it.
Right.
Or it's a person who, like me, when I like freaked out about my A1C last year because it was like 5.6 and then I found out it was really 5.3, but I like had my doctor order an A1C for me, and he was like, the medical assistant called me and was like, just keep working on diet and exercise.
You're like, no.
I lift 3 to 4 days a week. I hike. I do yoga. If anything, like, I'm on the border of doing too much. Like, I ride that line really fine. But like, you can just say it to the wrong person, And again, I love what you said earlier about like, it's okay to, like, I wasn't going to have this conversation with the medical assistant, but to go back into your doctor and say, hey, like, I just can I give you some feedback about what that experience was like for you, and like why that could be detrimental? Like,
I mean, I can tell you on the other side of having high cholesterol or borderline high cholesterol, I got my results before my doctor had had a chance to review them, because they got posted to my portal. And I was concerned because I was like, I don't want it to get past borderline high. That's not going to work for me. And so I messaged her immediately and was like, hey, from the background that of me, and kind of re-explained so that she had all that and wasn't like, who is this? I got to remember who it was, this is what I'm doing right now. I'm tracking my food. Like, I sleep 7 to 9 hours a night. I work from home, but I get, 7,000 to 8,000 steps a day, blah, blah, blah. Went into all this detail. And she, I said, what else do I need to be doing? And there was some in there that was a little bit more specific. I do like my doctor, my GP. She does a good job of, like, she even talked about like current research the first time I went and saw her. And I was like, okay, I like you. But it was not as specific as what I needed. And so again, I still had to recognize her limitations, that she gave me what she could. She talked about fiber and doing a fiber supplement to add some extra fiber. She talked about maybe bringing down red meat some. And so I was like, okay. At that point, that's when I took it into my own hands and went to Ari. Again, she's the registered dietitian that works for level 10, and was like, help me out here. Like, what do I need to be doing? Like, I will tell you and be completely honest with you about everything that I'm doing. Like, I like to eat ice cream. I sit on my couch, but I also like strength train hard, blah, 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 whatever. And she reiterated some of those things, right? That, like, we can try a reduction in red meat. We can try doing maybe some, like, a more, either like a plant-based meal a day, or just to get more veggies in, not necessarily for like, I need to go plant-based. Let's be very clear. That was not the recommendation. But to get more fiber in from, veggie sources as well. And she was like, you can add in the fiber supplement too, but like, let's try to get in more from like your whole foods and everything. And I was like, I normally get like low end is 25. Like, I'm adamant about that, because I'm like, that's what I tell our clients, like low end 25 a day. But if I'm eating 22 to 2,400 calories, it's normally pushing like 40, right? Like, I'm doing a decent amount.
Same.
But that's what I did. I implemented those things and it worked, but I had to talk to somebody else who was in the field. And that is okay. If your doctor doesn't have more information for you, talk to somebody who does.
Yeah. And I think that they're
a nutritionist.
From like another perspective, like as a medical provider, like I think that there are a lot of, there's a lot of pressure put on us too, like us who are like really, and like really try to listen to you and really try to do the things. Like, I had a patient berating me in my office, like screaming at me the other day because she's gaining weight and we don't know why. I've done the PCOS workup. I've looked at all of it. I even threw a CGM on her to be like, okay, like your glucose was a little high. Like, let's make sure there's no glucose issues driving this. I mean, so many things that I've done for her. Like, I want to be very clear and pat myself on the back. Like, she's not going to get this anywhere else in conventional medicine. She's not. Very, very rare.
I have not heard of someone even considering putting a CGM on somebody because of weight gain.
Yeah. Cause I'm like, I wanted her fasting glucose was like 104. So I'm like, let me do my due diligence here, and, I'm talking about like testing her for Cushing's disease and I wanted her to do an Everlywell cortisol panel, which is something else I wanted to bring up to people. If your doctor is like really adamant that they won't order the test, freaking order it for yourself. Like, you can do that with Everlywell. I know there's other companies out there. There's other labs like that you can go to and order your own labs. Like, you can literally take your health into your own hands these days. So, but I just kind of wanted to touch on that where like, there are some of us out there who are really trying, and like, you can't Amazon Prime your medical diagnosis sometimes. Sometimes it's harder than one round of lab tests. And I understand that is really frustrating for people. I understand that. And I empathize with this lady, but she was just like, you want me to spend all this money and do all this stuff? And I'm like, listen, like, I'm not in charge of your finances. Like, you have to make those decisions for yourself, kind of thing, But, sitting back and really asking yourself, like, is my medical provider like actually trying? Like, I think most of the time,
that's how I felt. Like, my provider, she was giving me what she had.
Yeah.
And I know that she is, like I said, the first time I remember texting the level 10 coaches and being like, I'm so happy that my provider, like, because I switched insurance, that, I mean, I don't even remember what it was about, but I remember her specifically talking about it. I want to say maybe it had to do with maybe skin cancer in women or something. And she was talking about wearing sunscreen and like talking about research. And I was like, who does this in their first visit? Like, this isn't, and I was like amazed, you know, I was so pumped that I was like, she's talking to me about current research on making sure that even in my, you know, late 20s that I'm making sure of this, because like, you know, I don't know, it was just, to me,
Yeah.
very helpful. But I, again, recognized once she sent that message back about cholesterol, I was like, you know, I wasn't mean to her. I was just like, is there anything else
Yeah.
with what I'm doing? She gave me her thoughts. And then I said, hey, Ari, can we jump on the phone? I'd love to, you know, pick your brain about this. And again, it helped a ton, but I had to ask questions to see what was the knowledge she had. And if, again, your doctor doesn't have the knowledge, it's okay. Find somebody who does. And it may not be a doctor. It may be somebody who's got a PhD in that field. It may be somebody who's an RD. It may be somebody who has a master's degree in that field, or even a bachelor's degree in that field could be beneficial to you, right? A bachelor's in nutrition, they're going to have a hell of a lot more knowledge than a doctor is in
Than your
nutrition.
doctor.
Yeah.
100% agree
And
with
that's
that.
not bashing doctors. That's just saying they're like, I was on a pre-med track. I only had a nutrition course under my belt because I took a separate nutrition course. It was not a pre-med requisite for me to have any kind of knowledge of nutrition. There's none. I took botany. Botany has nothing to do with, you know, like, yeah, that was like one of my elective biology courses. It was great. I enjoyed the class. Had nothing to do with helping people, right? Like,
Yeah.
just understand what you're getting into. And again, I think the biggest take home of this entire thing has been a couple of points, right? Don't be afraid to ask questions, just do so respectfully, right? Make sure you're very respectful in how you ask questions. You can ask why and keep asking why to get to the answer that satisfies you. And if it doesn't, you are allowed to go somewhere else. You know, don't be afraid to talk to your doctor if things aren't going well when you're given prescriptions, medications, whatever, if it doesn't sit right with you, if it feels like it's changing your body, if it's changing your mental well-being, chat with your doctor and let them know, right? Don't be afraid to let them know that things aren't going well. Kind of the biggest pieces, but honestly, the other one is don't be disrespected by doctor.
Yeah.
Don't let it happen. I mean, I know they're going to try to, they may try to have that happen. Don't let it happen. You, as soon as they say something that is disrespectful for you, stand up for yourself. And if you don't feel comfortable with it, walk out of the office. I've also had to tell people, hey, like, if they're saying things that like really make you upset to where you're going to cry, you can absolutely say, I'm sorry, I need a minute, leave, go collect yourself in the bathroom, come back.
Yeah.
Do what you need to do to keep yourself protected, and understand again that they're humans who have emotions, who believe, you know, have assumptions. And we don't like when anybody makes assumptions. We all know what making assumptions does.
Right.
Be okay with disproving those assumptions, right?
Yeah, for sure. I do have a couple more that I want to touch on, if that's okay. And this one goes both ways for me. So when your labs are normal, but you still feel like shit. So I feel like this is a really big one for me. And I'm glad that someone made this comment, because I feel like the functional and naturopathic and conventional realms just do this with it. And it's like, nobody's right. And I'm like, what if there's some duality here? Because I think there's a segment of the, and I'm not talking about the person who asked this question, because I know them very well. So there's a segment of the population who they have a really crappy lifestyle, but their labs are still normal, but they feel like crap because they're not sleeping, they're eating really bad, and yada, yada, yada. And they're like, well, I don't understand why I don't feel good. And I'm like, well, that. And then there's another segment of the population that goes to their like regular GP, conventional medicine. And, you know, people don't know what labs that their doctor's running either, which, can I drive that point home again and say, please ask your doctor, like ask them to write it down for you or print it out. So, and like, if you don't understand what one of those labs are, please ask them, because, you know, patients come to me all the time. They're like, well, they tested my thyroid. And I'm like, I guarantee you there's just a TSH on there. There is not a full thyroid panel.
Very different.
There's not. And so it's like, are you saying that you have all of your labs are normal based on like basic conventional medicine standards with like a CBC, a CMP, a lipid panel, and an A1C? And a TSH with a reflex T4 if you're lucky, because that's what most conventional doctors are running. You know, I'm running vitamins, I'm running, and you know, vitamin B vitamins, magnesium, vitamin D, a full thyroid panel with all of my patients. So that means something different based on the circumstance. So, and I also think that sometimes it's like, you need to refer, like, I don't know everything. So like, if people are having strange symptoms, like I've had a lot, all of my students are always like, you don't see anything that's like straightforward in your practice. And I'm like, I know. It's
I think it's
painful.
also because like a lot of people, it's not that straightforward. It's not just one small thing and that's causing everything. It's not like, oh, if you
and
just
I say this all the time, that I think it's because I ask the questions that I get the responses and the problems that I do. So I end up referring, and there's a lot of specialists that I won't refer to because they dismiss my patients, and I try to give and then I'm like trying to teach my patients like how to advocate for themselves. Right. And it's like, oh my God, what have I gotten myself into? But, you know, if your labs are all normal, I would ask like, which labs are you running? Like, what's your complaint? Right. Like there's so many questions that I have in this particular situation. Yeah. Like, are you tired? Are you, you know, the biggest thing to a lot of people who are worried about cortisol issues, or they're tired, like they're just doing a cortisol awakening response, which like
versus looking at the whole day or
yeah,
something.
like I really need to see the trend. And like, I'm about to run my first Dutch test finally. And like they even give you the option, like if you wake up in the middle of the night, which I always do, and I'm like, oh God, it's going to show me that I just have cortisol through the roof. Like I go right back to sleep most of the time. But you know, like, do you have that option? Like Everlywell does a really good test for that. So if that's why you're not feeling good because it's a fatigue issue, I would point you in the direction of like, okay, maybe you need a timed cortisol test instead of just you know, a cortisol awakening response. Vitamins, nutrients. I mean, those things, if they are not where they need to be, they make people feel like shit. Like,
I mean, how many people talk about getting like, oh, I got a B12 shot, like because their energy is garbage, but I'm saying like people are willing to go do that, but you don't want to get your vitamins tested.
Yeah. And so for me, you have to test before I'll give you those things.
Sure,
I know people,
absolutely.
I know like, I know a lot of people will just, there's like, you know, the aesthetic boutique, like concierge medicines here who will just like give it to anybody. And I'm like, maybe we should be testing, because like you can get neuropathy from like having excess B12 too, but okay. Not my circus, not my monkeys. I don't do it.
Yeah.
I get so many patients too who are like mad that I require them to test like hormone replacement and things like that. I'm like, I had a woman actually like yell at me and tell me, I don't know what it's like to be without estrogen. I don't understand the importance of hormones. No, you have high blood pressure and you smoke, so I can't give you estrogen. It's just,
you have to be smart about your health. Yeah.
You're going to get a blood clot, sweetheart. I don't know what to tell you.
I want to take care of you. I don't want to hurt you.
Yeah. So, those are my thoughts on your labs are normal, but still feel like shit. Do you have other thoughts on that?
Yeah. I mean, if I heard that, I would be asking why. Like, I would be asking more questions. That's always feel shit. How? Like, are we tired? Are we having like very big peaks and valleys throughout the day? Again, which I would still think like probably something related to cortisol. Are we eating enough food that we're, you know, fueling enough, or are we trying to live off of 1,500 calories and not feeling great? Are we exercising a ton? Are we under recovering? How is your sleep? Like, and that's my realm, right? That is where my education, and that's my lane, right? If it goes past those things and you can tell me and show me that we're sleeping 7 to 9 hours a night consistently, your food quality as well as amount is good. If you can tell me that you're managing stress and there's nothing that I'm seeing from you talking about your lifestyle that I'm like, whoa, are you actually managing stress? Or like, what about this guy over here? Right. Yeah. If I can go through all of that and I see nothing sticking out, then that's when I'd say, hey, like we may want to look into getting some kind of other blood work or something done, because this is now outside of my realm of, you know, what's in my lane. Mm-hmm. I can suggest lab tests that I think could be beneficial based on something. I will never prescribe that. That's again, not my lane, but I will say if I have all of these things in line, this is typically what the next response would be. Like if this was happening to me, I would probably be looking into these things.
Yeah, and then, totally.
Again, refer out. So ask the right, you know, dig a little deeper into the why you feel like shit, and let's get a little more specific. Make sure lifestyle is
on point.
Yeah, and then go from there.
I unfortunately don't know a lot about this. It's actually on my list of things to kind of dive into, but I was so dismissed about pain with sex when I was on the pill. I know that this is something that can happen to women, and I know Nicole Jardim had a doctor on her podcast, Dr. Batsheva, B-A-T, and her last name is S-H-A-V-A, and she wrote a book called Sex Points. I have not read the book, but it's basically revolved around vulvodynia, which means vulvar pain, and then like dyspareunia, which is pain with sex. It is on my list of things to read because I feel like this is such a problem, and women are so dismissed and just told to use lube and see you later.
Okay. That's again, I would advocate for asking for a different type of birth control if that's what you're looking for, because you shouldn't deal with that. And it doesn't mean that it's not an effective pill and what it's probably doing what it should be doing, but any medication that causes side effects, any other medication, right? You go to a doctor, this is giving me side effects that are not great and not conducive to my life. We look at dosage, we look at, can we switch to a different type that's maybe a different pathway? Doctors do that all the time. This shouldn't be any different.
And it's one molecule, it's one organic chemistry, like little hydrogen molecule, like there's still little differences, but it makes a difference for some people. So I think that's a really good point. Like, just like my friend who I talked about earlier with the UTIs,
and like combo pills versus like progestin only pills versus, like that, like a mini pill might be a better option and still does the job. So, again, I'm not going to say I have a ton of knowledge specifically on that or why that happens. But again, this is that medical piece of, if a medication's not working for you and you're being dismissed, just say, hey, I'd like to try a different medication, because there's plenty of birth control options out there that you can try. And there's a good chance that one of those is not going to do that, because they do have different ways of working.
I would also be curious if this person had these issues before they went on birth control. So like advocating for a root cause too, and saying like, because I think a lot of doctors would probably try to like prescribe some kind of lubricant or like make sure prescribe estrogen if this person, to my knowledge, is not postmenopausal. So being like, well, I'm kind of interested in why is this happening, because sex shouldn't be painful. So is there any kind of workup that we can do?
Before.
Right.
You say, hey, I wasn't having this happen before and now I am. And the only, again, this is like the scientific method. What's the one thing that we've changed is adding birth control. Then maybe we need to try something different. And I mean, I was on birth control. Again, I just got off birth control like a month and a half ago. And the only time I've been off it was when my husband was deployed. I didn't take it for the 9 months he was gone, but I've been on it since I was in high school. Right. I've gone through a couple of different ones, and there were ones that I didn't do well with. The first ones I was on in high school made me gain weight, and I switched to a different one because I was not comfortable. So you can absolutely do that. And again, you shouldn't have to have a reason why, but when you do really have a reason why, like having painful sex, that should not be, right? That's not what sex is supposed to be about. We should be able to have just another option. And there are other options. So if they're denying you that option, keep asking or find somebody who will allow you to try another option. There's no reason to not.
Yeah. And that kind of like goes into the next gal who asked the question. I'm 32, reported having intense pain during my period. My midwife gave me a PMS handout and sent me home. I then went elsewhere and ended up having 2 masses. Is there anything you can do besides leave? Sometimes there's not. Sometimes it's just, I mean, this to me sounds like negligence, and I am not like a super litigious person, and I don't advocate for like suing healthcare professionals, because we are human and this is a practice, but there is also gross negligence, and like report that person, write them a bad review. If it was like actually that bad, like call their manager, like we have a patient experience line that like, or patient experience I don't know, some kind of patient advocacy line that you can call. And
it's probably anonymous, that you don't have to,
it is
not going to be out there for them to like, hold anything against you. Not that they really could, but like, it's not going to be attached to it. And you can still make sure that that doctor is held accountable for.
But my question to someone like this also, because I feel like there's a lot of people who are like, well, what else can I do besides leave? And my question to that person is, what's wrong with leaving? Just a thought. I mean, because if you get a couple of bad haircuts from the same person, you don't stay, right? Like you go elsewhere. If you get a bad dye job, you're like, that's not what I asked for. That's not what I paid for. I'm not going back, It's sad that it comes to that, but I do think that a lot of the times that is the only option. And I think in this circumstance, I'm going to use Nicole Jardam's line. She had said, you know, if you had knee pain, your doctor would do an evaluation as to why you had that knee pain. Why is your reproductive system any different? So, you know, and I would also say things like, you know, this is really important to me and this is really interfering with my life. And it would really mean a lot if we could figure out why this is happening. You know, statements like that, I feel like there's nothing wrong with that.
Absolutely
you know?
not. I mean, speak from your heart on those things. You know, if you were really having something, especially like that, I mean, that obviously was huge. But the other thing I was going to say too, with PMS symptoms is they shouldn't be so severe.
Correct.
You should not, that is not, just because people normally have cramps, normally have bloating and things like that, you should not be doubled over in pain every day of your period. Like those things are not the norm. And we do want to find ways to cope with that, whether it's medically based, whether it's lifestyle based. Puppy friends, of course.
See this?
Oh yeah. Oh yeah.
Oh my God. It was just
That's
like
awesome.
on the pod, just came from nowhere.
It was kind of like one of those, like, I'm here to talk to you about your car's extended warranty creeping in on the side. Oh man, I love
Over
it.
here, dude.
Dogs, always. But yeah, I mean, if you're having severe PMS symptoms like that,
Not normal.
talk to your doctor. It's not normal. It's not normal.
Yeah.
We
And
talked about
I
this
think-
briefly too, that, you know, a lot of times women, when you're not eating as much food, that those symptoms get worse. And that when you
For
start
sure.
eating food, that those symptoms get better.
Dude, so
Again,
my
it's not gonna
student
solve
today,
that, but, you know,
my student today picked up on that. He was like, I'm finding a trend that women who eat more and they eat healthier don't have period symptoms. And I'm like, very good, young grasshopper. Yeah. Like very
Yep.
good. Yeah.
Very, very common thing.
It is. It's so common. So yeah, I wanted to point that out, that even my student noticed it today. I was like, oh,
That's awesome.
I'm making a difference in the world.
Yes.
So I have another one from someone who said they had unexplained weight gain. So same kind of thing, told they were fine. And the doctor just suggested metformin. And my answer to that is like, did you have fucked up glucose? like people use like metformin, Wellbutrin, and like Adderall as a triad to like help people lose weight because it's like appetite suppressants, and metformin will help you lose weight. It's like a side effect. And then we're like,
I said, like with Adderall, I was like, so you want to just like put them on like low dose speed?
I mean, that's what phentermine is. You
I
know what I
I
mean?
know. I'm
like,
just like, ooh.
Yeah, not okay.
And I see it all the time with people once they come out of college and they stop taking their, you know, ADHD and ADD medicine, and all of a sudden they gain weight. And it's like, oh, it's because you have an appetite again, and now you're not moving like you were when you were on that. And because you know, your focus and energy is not where it was. And it's, oh gosh, that's a whole other
holy hot mess. But yeah, I would ask that, you know, if someone was trying to put you on metformin for weight loss, I would say, I understand that that's a diabetes medication. Why are we discussing this for weight loss?
Or just, even if you didn't know that, anytime a doctor says they want to put you on a medication, so just to make this a more broad response, ask what the medication is for.
Yes, I love that. So many patients don't know. So like, why are you giving me this? What is it for? And are there other natural things that we can do?
Is there anything I could be doing lifestyle wise before we go to that route? Is it an easy way to just ask if there's, because there might be, and they may tell you diet and exercise, and great, then you need to find somebody who can help you in that realm. But ask those questions and ask what medications are for. I mean, I can tell you right now, I didn't know, and I was a child at the time, but when I was put on the medication I was on, the medication for anxiety is also typically a medication used for depression. You know, and not knowing that, not that it's like a bad thing, but I was like, oh, you know, just not being informed. Right. And so you can absolutely ask what the medication's for. Are there any side effects that are prevalent with it? I think is another great question. If they are trying to put you on a medication, you can ask those things. And a lot of times I would say doctors typically try to be like, side effects can look like this. If any of these things happen, like, let us know. But if they don't, ask. And again, just ask what the medication's for.
Yeah, for sure. I think another important thing with, like, you know, if we're talking about medication versus lifestyle, or someone wants to start you on something like a cholesterol med or a med for, you know, diabetes, a really good question is, you know, is this emergent or can we watch and wait? because there are a lot of things that you can kind of like feel out and that are not emergent, that you can just wait and see what happens. So I think that that's something to kind of like, can we watch and retest? Can we watch and implement some different things?
Yeah, absolutely.
I think is a really good question. Last one that I have is, I actually have two more. So I kind of already addressed this. So getting hormone testing done. My last gynecologist suggested going back to birth control or Xanax. No. Find a new gynecologist is my answer to this. But also, like, I want to be really clear that like 60% of women who are on birth control are on it for non-contraceptive reasons. That's a huge number. And granted, that's the high end. So I think they say anywhere from 40 to 60% of women are on it for like period problems, dysmenorrhea, menorrhagia, so like heavy bleeding, painful periods, PMS, PMDD, which is premenstrual dysphoric disorder, so like more intense PMS. And we've just, I don't know, Marcus and I were having a conversation about like different things, and he said something that I think resonated to this, and it's like, when women stop tolerating it, people will stop doing it. And I thought that that was a really important point. And I think that we're starting to see a shift in that. You know, there's so many people in our space now really talking about like, you deserve answers.
Yeah.
And I think that eventually, and that's part of the reason why I'm starting Empowered Medicine, and I want, you know, why I'm doing the things that I'm doing. And I'm like trying so hard to like get information out to people, because, you know, I saw a girl the other day who she's on an IUD for, I think it was either painful or irregular cycles. And she was like, I, you know, gave her some information. I was like, and I'm very, very like, when I go into those conversations, I say, listen, like, are you open to a conversation about this, to some other information that you probably haven't heard before? And she was like, she was in nursing school, and she was like, absolutely. And so I just told her about, you know, it's your period is your fifth vital sign, your menstrual cycle is your fifth vital sign, and your hormones are important to your health. And this, you know, is something that I suggest to my patients look into. And I gave her some books to read. And she was like, I'm so glad you told me about this, because I have four sisters, and I can't wait to tell them about this. And I'm like, that is how change happens though. Like, I mean, it just, that is the stuff that keeps me going like day in and day out, because I think that Marcus was right. And on some level, it's like, when any group of people stops tolerating said thing, like that's when that said thing starts to change.
Yeah.
So I think, you know, really pushing your gynecologist or your GP to like give you answers, and, you know, educating yourself. And I'm going to be putting out a module just about like how to test your hormones. And like, it's going to be part of my like menstrual cycle 101 lecture, just like, when should you test your hormones, and what does that look like, and how to ask for it, and things like that, but which we kind of covered. So yeah, I also think you probably need a new doctor, because you shouldn't need Xanax because of your hormones. Like, that's just, it's, and no harm, no foul to anybody who needs to use anxiety medication. However, your hormones, if nobody has read the book, if you haven't read the book, Your Brain on Birth Control by Sarah Hill, it is such an incredible read about really, truly what birth control does to our entire bodies and our brains, and the way that we think, and the way that we process decisions, and the way that we emote. I can't recommend that book enough to people.
I'll say, to add on to that it is not a book advocating for not being on birth control.
Correct.
Or being on birth control. It is she does a very good job of making it very clear of these decisions on your own. And now I want to help you make it an informed decision.
Correct.
Which I think is incredibly important. And again, if you're going on birth control, and I think every female I know was on birth control in college, you know, all of us were, but I didn't have severe symptoms to need it as a high schooler, other than if it was for a contraceptive, you know, like purpose. There's tons of 15 to 16-year-olds who don't need it yet. And maybe parents want to be more safe about it, but could we have conversations instead? That's a whole nother route, but you know what I mean? Like,
no, I totally agree with you.
If you're in your 20s or your 30s and you're not dating somebody, you don't have to be taking it, right? Like, if you're not having the severe PMS symptoms, like having some cramps is okay.
Mm-hmm.
Like having some bloating is okay. If it is not severe enough for you to need to be on a pill to shut everything down, you don't have to do that.
Yeah. And you can only get pregnant 6 days out of the month. So consider the fertility awareness method. I have to put my plug in there.
I was talking to my husband about that. It was so funny. He was like, that's it? And he was like, how do all these high schoolers get pregnant? And I was like,
because that's when they're horny.
I was like, they're literally, yeah, I was like, because their hormones are actually working. And so they know like this is the time.
Right.
Whole other boat. But anyways, again, I agree. Read that book. Listen to it on Audible. That's what I did. And I loved it. And honestly, I shared about it throughout the time I was reading it. I had a bunch of people being like, let me know how it is. Like, do you suggest it? And I was like, yes, yes, and yes. Yes.
Yeah, totally.
Yeah.
This person, this is the general question here is kind of love to know recommendations on how to find providers who are more in line with my thinking. Feels like a stab in the dark on my insurance list. So I think what I talked about earlier, like asking the front desk when you call to schedule. So this person is specifically talking about not wanting to take birth control or spironolactone or other like kind of harsher medications for acne. So calling those dermatology offices and say, hey, like can you tell me about the prescribing practices of your doctors? Like, what is their first line treatment for acne? Will they talk to me about lifestyle modifications? And I do want to make another point here. And I think that this may piss a couple of people off because I know it's not like a happy little answer.
It's pissing somebody off. I'm shocked.
You know, you don't have to stay with your insurance. You don't have to see a conventional doctor. Like, I realize that costs money. But I want people to sit back and look at all of the money that they have spent trying to reach their deductible to get answers in the past. Like, truly sit back and ask yourself, like, how much money have I spent trying to address my gut issues or my period problems or my headaches or my weight loss or X, Y, or Z? These are the same people who like maybe might be hesitant to invest in a coach, like a nutrition coach, but they've tried every other fad diet.
Absolutely.
It's like you've spent $4,000 through conventional medicine in the past 2 years and you are still in the same boat. Yeah. Like, go hire a naturopath. Like, go see a functional medicine doctor. Find somebody on the internet. Like, I mean, I have plenty of suggestions of people who are doing internet business who I think are fairly reasonably priced for those types of things. So,
and again, if you're going outside of your insurance, I mean, look into having an insurance plan that has like an HSA, right? Yeah. Where you have some funds that can be put towards other things, right? Like, I don't have vision insurance, but I have horrible vision. But I have an HSA account and I have a place that I go, and I'm on the second office of this chain, but I went to the second office because I didn't like the first one. Again, I just decided to leave. I said, I wasn't happy there. I'd like to see another doctor. I'd like to get a second opinion because contact prescriptions, hello, I can tell if I can't see. And second doctor was like, I think that this is what happened. Like, cause I have an astigmatism. She corrected it the other way and said, we're going to try this. And she said, let me know if this is better. Already much better. Fantastic. But my HSA account is what I'm using for that because I don't have vision insurance. Yeah. So you can put more of your money towards that. You can
tax
pull
deductible.
Yeah. I mean, well, and again, if you're a fitness coach, obviously, hallelujah, that's a write-off. I love that. But yeah, if you didn't know, if you're paying for your own insurance, that's a side note that does not have to do with this podcast.
Do you have an accountant that you love, by the way?
I do. It's one of my friend's moms. She's great.
Are they Georgia based or are they?
She's in Georgia, but I don't know if she only works in Georgia, so I can let you know.
Because I can ask her. This is like totally off topic, but I want someone who will let me be liberal with write-offs, but not cause me to get audited. We'll talk later. Yeah. But yeah, so definitely like use your HSA. Like, don't be. I know it's scary and it sucks to like pay out of pocket.
But if it's getting the answers that you want, isn't it worth it?
Like, I know, my friends Derek and Ashley from Ballistic, like Derek has been really open about talking about his gut issues that he's had. And I think it cost him like $1,000 or $1,100 to work with someone for his gut, but he's actually starting to feel better.
Right.
Like, holy crap. Like, you're going to probably pay $300 even with your insurance for an office visit alone. Like, that's a third of the way there, a fourth of the way there. Like, I obviously, like, I can't make financial decisions for other people. And and I get that. And I know a lot of people, like, really 64% of America lives paycheck to paycheck, by the way. Fun statistic, not so fun statistic. So start a savings account too. Financial wellness is important, people, not the topic, but we're saying it anyway. I'm starting to get off topic. I can tell I need to like wrap it up because I'm starting to like, I'm starting to think dong. But yeah, like you don't have to there's no rule that says you have to work with your insurance. Like I know plenty of functional dietitians who are doing this work. You know,
and again, a ton of people accept HSA, FSA stuff. That is, if you are going out of, what is it called? Like
out of network.
Out of network. There we go.
I gotcha.
You can do that. And some insurance still will do some help
reimbursement
out of network. Right. So, just look into your options there too. I understand insurance can be sticky, but it's worse to stay with somebody who is not helping you and you're just paying into this insurance that's not doing anything for you versus maybe paying a little bit more out of pocket to get the right answers, right? Or to get just, feel heard by your doctors. I think that's really important.
Yeah, totally. Final thoughts?
Always ask why, be respectful, but also understand that doctors are humans too. And it's okay to ask questions. And it's also okay to not necessarily take your doctor's advice and find somebody who's, maybe knows more in the specific field you're looking into.
Yeah, for sure. And the thing that I want to end on with that is, I talk to my patients a lot about, a lot of people are averse to therapy because they had a bad experience with a therapist. And my response to that, and I think this goes the same with like, if you don't find a good doctor on the first try, which totally sucks, right? Doctors or therapists, like you're putting effort, you're paying money, like it sucks when it doesn't work out. Like I feel you people. I tried like 4 or 5 therapists before I found Megan. I don't currently have I'm being my own doctor right now. I'm going to be really honest. But when you go get a bad haircut, you don't stop getting your haircut. You just find someone new. So don't give up because of one bad experience. Like don't write us all
shaking his head behind me right now at what you're saying.
Really?
Well, he had a bad haircut experience actually, like, I don't know, it was maybe 6 months ago, and he has found a new place and he's much happier.
Look at that.
Yeah.
So that's, I think, what I want to leave everybody on today.
Yeah. And if you guys have more questions or other situations that you're like, this is what's happened and I'm trying to figure out the next steps, like, what do you think I could ask? What are questions I could ask to get more answers, or what can I advocate for, or what should I be looking into? Again, we're not giving medical advice. This is more about how to address your doctor or physician assistant or whoever you're working with, how to talk to them to advocate for yourself and find a new doctor if needed, if that's not going to work in your favor. So we're happy to help.
Yeah. So, you can find Shelby at Stronglike Shelby on Instagram. This is going to go up on the YouTube if people are watching there. Hello. Is it up right now? Is this live?
No. Oh my gosh. No, it will not be live. But I had a series that I did during the pandemic that was called Stronglike Talks, that were just me talking with individuals. Like one of my clients who has PCOS, we talked through her journey. I've talked to other coaches. So this will fit perfectly into that. So this will be great.
Yeah. Awesome. You can find me at Danielle.Kepics or at empowered.medicine. I promise modules are coming out soon. Oh my God. At some point, I'm going to record something to put out, but Alex is working on my website. So soon I will have an awesome website.
I'll be tagging everything in the description below, the Instagram pages, as well as I will tag the level 10 email list and Danielle's email list, because those are both educational email lists that if you're not on them now, it'd be a great place for you to start learning some more education that's fitness, nutrition, health, all the good stuff.
And it's free.
It is free. Yeah, we love that.
Cool. All right, guys, until next week, keep it strong and unfiltered. Later.